Mr. Speaker, 1 century ago, our country was in the midst of the worst pandemic in history. It claimed the lives of almost 700,000 Americans and killed more than 50 million people worldwide. Mr. Speaker, we listened to testimony, we discussed aspects of this legislation before us today, and it is critical that we remember the significance of the centennial anniversary of the 1918 influenza pandemic as we consider this legislation today. The creation of the Assistant Secretary for Preparedness and Response under the original legislation in 2006 has helped us to make monumental strides in preparedness, coordination, and response. Close collaboration between the Centers for Disease Control and the Food and Drug Administration and our state and local and territorial public health partners has been vital in making this progress. Much like politics, much of public health is local and executed on the ground by our hospitals, our health departments, emergency responders who are our front lines in addressing infectious diseases, disasters, and threats. We must evaluate the domestic biologic surveillance systems such as BioWatch. This bill will help bring those programs up to date so they are operating with the most efficient capabilities and technologies. We must also look for innovative ways to continue to advance our medical countermeasures and ensure that Americans can access the medications that will provide critical protection in the future. As we consider the problem of antimicrobial resistance in this country, we must discuss new methods to curb this growing problem. This reauthorization bill, and it is important to note that this reauthorization bill is being heard on the floor of the House prior to the expiration of the fiscal year, at which time the current authorization expires. The House once again has done its work in this regard, and we do urge our counterparts in the Senate to do their work as well. This reauthorization includes an important provision, the Mission Zero Act. The Mission Zero Act seeks to connect American patients with battle-tested trauma care through the craft of military trauma care providers. The bill provides grants to allow military trauma care providers and teams to offer care in our nation's leading trauma centers and systems. The need for top-notch trauma care extends across our nation, far away from the battlefield. I first introduced this bipartisan bill with my fellow Texan, Representative Gene Green, following a police shooting in Dallas over 2 years ago. Over 2 years ago, 5 police officers were killed and 9 more were injured in a shooting in downtown Dallas. In the immediate aftermath of the attack, area hospitals sprung into action and activated their disaster plans. The staff at Parkland Hospital, Baylor University Hospital, and other medical professionals provided excellent emergency care to victims of the attack. Frontline facilities and responders in Dallas experienced this firsthand in 2014 when a patient presented with Ebola to a Dallas-Fort Worth emergency department. We must remember that infectious diseases are a mere plane ride away, and we must continue to ensure that we are prepared and ready to respond to emerging infectious diseases worldwide. This pandemic all-hazard preparedness reauthorization is critical to protecting the lives of Americans and providing the necessary tools and infrastructure when disaster strikes. I want to thank Representative Susan Brooks and Anna Eshoo for their work on this legislation before us today. I strongly support this legislation and urge my colleagues to do the same. I yield back.